Thank you for joining us for another PrEP Advocates Unleashed, PrEP for All's newest series, where we interview PrEP users and advocates from around the country to talk about the great work that they're doing in their communities, as well as their journey for accessing PrEP, how it's changed their lives, the benefits of it, the challenges they have experienced, and what solutions they see for making sure that PrEP is accessible to the communities that we are a part of and that we serve. And today we are joined by Devin from AIDS Alabama. Thank you for joining us today, Devin.
Thank you for having me.
So, gonna jump right in and ask, what made you decide to get on PrEP and when did you first learn about it?
Oh God, so I have been on PrEP since the summer of 2015. I lived in Kansas City at the time. I was always one of those people that got tested pretty regularly because I was back in 2015. I was one of those people that was scared regular was scared regularly. So I learned early on to get tested. Back in the days when it took 2 weeks and a phone call from the health department, and they let me know about PrEP. They let me know about copay assistance because I didn't have a job that had insurance at the time. And they got me on, I don't know if we name it, but 2015, we all know it was Truvada. They got me on Truvada and I stayed on that until this past this past summer when I switched over to the long-acting injectable.
Okay, great. And how has PrEP like benefited you? Like, has it helped your sex life, your romantic life, your mental health? It's just like so many different aspects that it could
Yeah.
help to, improve. Like, how did it help your life?
Yeah, definitely the mental health aspect, just the understanding that I had protection against HIV. I didn't always ask questions, of sexual partners when I was out there, but also, I've never discriminated against having sex with people that are HIV positive and are vocal about it and that are undetectable. So it just gave me that peace of mind and kind of gave me the ability to be even more open to, serodiscordant sexual relationships, romantic relationships. Um, you know, these days it's a good conversation starter. Like, I'm on prep. Which one?
So tell us a little bit about the work that you do with AIDS Alabama, helping people.
So I'm community outreach specialist for AIDS Alabama South here in Mobile. My primary task is I'm in charge of our two-room clinical RV. I take it out into the rural communities to provide testing for individuals that may or may not have access to testing services, that don't want to talk about it, that have been married for 60 years and don't feel the need to have an HIV test. But, sometimes the young, fresh faces at the table will be like, oh, sure, I'll support it. I'll go ahead and do it. And I'm also a person in long-term recovery. So I'm working, hand in hand with treatment centers, with our outreach specialists that are already in treatment centers, to get that access to testing for not only HIV, but also hepatitis C. I get to use my voice to talk to some of the higher ups in the treatment services in Alabama to be like, I know y'all offer it to them, but I need y'all to kind of like suggest it to them
Right.
because the results are popping up and the treatment is there. But people in 30-day treatment, like HIV and hepatitis testing is not the first thing on their mind, even though it's like the easiest thing to get done because it's free and we're there.
And so a lot of how do you see PrEP benefiting your community? And what are some of your experiences with talking to people about PrEP in like rural communities where you may not have like the same campaigns that you would see in New York or San Francisco?
A lot in the rural communities, it's like sometimes it's like people just have no idea that it's there or that it's as easy to get as it is. And that really may just be from my experience because I had such ease of continuum of care with it. But that initial conversation when we're testing them, like, have you heard of PrEP? And they're like, no. And I understand it for, our more elderly community, didn't come on the scene until 2012. So I understand that. But like our younger community, sometimes I have to catch my face when I'm like, you're not on PrEP? Why? You could, you could, you could, I have a blister pack in the back. Like, you can have this now. We can set up a telehealth appointment, like, and we can be shipped to your house. Like, it is wildly easy to access. It kind of blows my mind sometimes. But, a lot of times in rural communities, it's just lack of knowledge.
And as the name says, our organization, Prep for All, we try to, it's we definitely know the people who have largely benefited from PrEP have been white gay men. And we definitely
Mhm.
see disparities in the South. We see the disparities in Black and Brown communities. We know that traditionally, only recently, we've really seen like conversations and engagement with a lot of populations that have been left out. So, Black and Latino, gay men, the cisgender women, the trans community, young people, people who inject drugs. We see all of these communities that have traditionally been left out. How do you engage people who may not have traditionally been engaged with, one, by healthcare providers around PrEP, but it's also like social marketing and community and major campaigns that just have left these populations out as well.
I know for me in my personal experience being in recovery, being a former IV drug user, being able to talk to other people that are, seeking recovery. I do a lot of outreach with the treatment centers, with like the recovery houses, things like that. I have some friends that have came into recovery that are now on PrEP. And they're like, oh my God, this was so easy. Like, how did I not know? And, a lot of times I'm like, the only reason that I am where I am today, in my recovery, in my mental health journey, is because I had all of those services throughout, even when I was out there using drugs, somehow I still adhered to adhered to my PrEP in enough to be protected. But it's a real sweet spot for me to be able to talk to people about that, people that have gone through, similar situations that I've gone through. Being a Black and brown person myself, it eases that conversation when I'm out in the rural communities. You get to just chit chat with each other like family. I don't have to be like this medical professional. So, I get to read the room, I get to read the people, and usually the engagement is pretty lighthearted.
Yeah, so I'm gonna ask you a two-part question. What are some challenges you have encountered with accessing PrEP, and what challenges do you see in your community with people accessing PrEP?
But with me personally accessing PrEP, I really haven't had any barriers. I don't like I've heard of barriers to it from other people with insurance, things like that. But I've always, when I didn't have insurance, there was copay assistance. When I had insurance, my insurance covered it. When there was a gap in, insurance coverage, changing jobs, there's specialty pharmacies and things like that. But I find particularly in this kind of silo of a community, if you know those resources, then it lines up.
Right.
But if you don't know, to ask the nurse about, copay assistance, if you don't know to, ask about specialty pharmacies, if you don't know those resources, then it can become a barrier. People who who may have been on copay assistance and then got insurance and that insurance doesn't want to cover it. What do I do now? We have to go this direction. But to know is to know, I guess. I wish that was more public
Right.
for access, but
Right. And a big part of the work that Prep for All has led, along with our partner organizations and over 100 supporting organizations, has been the call for a national PrEP program. Because we know, like I said, you go out into the rural communities and we know based on where you are, you may have different experiences around trying to access PrEP. Some states have like a PrEP program, or you have like these medication assistance programs or copay assistance programs, but trying to access prep in, say, Alabama or Georgia, or trying to access it like somewhere in the West Coast may be completely different experiences.
mm,
Um, so one of the things that's great that sounds like you're doing is actually meeting people where they are, going into the community and really taking that hands-on approach. So a big part of what we do is for and framing a national prep program is not just addressing like coverage barriers, but also looking at ramping up telehealth, provider expansion and education, also community-led campaigns. How would those things enhance the work that you're doing and make prep more accessible to the communities that you serve?
I think definitely seeing more seeing more marketing out there definitely be more helpful, things to like beef up our education. I know a lot of times we're still in the point where it's like you can't get HIV from a toilet seat, and people are like, oh,
Right.
like it's like we're still dispelling that stigma down here. So definitely seeing marketing campaigns that are geared toward those populations. Um, the cisgender Black women, they're getting a little bit more on board down here. Now the heterosexual cisgender white men, they're kind of a harder nut to crack when it comes to prep services. Getting people, that are in early recovery treatment centers to want to add a daily pill or an injectable on top of mental health medications and possible substance use medications, medically assisted treatment, things like that. Finding materials that can, help them identify with that and also make it not seem so much like they're just adding more on, to their already full plate.
Right. And we're in kind of unpredictable political times right now. So best way I can frame it.
Yes, great phrasing.
Yeah. But we do, I mean, the reality is that we can't sugarcoat it. We can't skate our way around it. There are threats to funding, there are threats to just the infrastructure that has been built for the HIV movement and making sure that people have the resources that they need. Even looking at the support services that people in our community have, we're seeing cuts to seeing the cuts to like Medicaid and Medicare and Social Security and SNAP benefits and a lot of different services. A lot of support organizations are losing funding or scrambling for funding. What do you see the impact of these funding cuts to both directly to HIV as well as the support services for communities impacted by HIV? How do you see that impacting the clients and communities that you serve right now?
Definitely will impact them by, lack of services. Like I'm very fortunate that our prevention services are still going. I have a friend that actually was the director at the clinic that I first started prep on that's like wiped out his entire staff, and that disturbs me because I know how important those services were to my life, and to see that people may not. have that same access due to politics and
Mm,
people thinking that this subset of the community is not as important. That's very heartbreaking for me. I just trying our best to stay out there and stay visible, even going into the spaces that, we might not normally go, aligning into the more heteronormative social gatherings, just so that somebody will see and, I don't want to say carry the message on, but, you know, I, I have a lot, I have a lot of friends that are HIV positive, and it's, it's just wild to see what is happening
mm,
funding wise, because one would think that that would be like a protected class of people.
right.
And to see it so haphazardly ripped away or threatened to be ripped away is not something I thought I would see in my lifetime,
Right. It's almost like
especially.
just really seeing this almost going backwards. You hear the
Mhm.
stories about, earlier generations in the fight for access to services
Yeah.
and for HIV, and it just kind of makes so much progress, like medication wise and technology wise, and now it's kind of going back. But again, thank you for just doing the amazing work that you're doing. Like um, a lot of people I know are discouraged right now around the work, but it seems like you're still keeping in the fight, going into the communities, talking to people, accepting the challenges that are there, and just continuing to move forward. So thank you for that, and thank you for talking about the work that you're doing with us today. If someone were interested in getting services from you, how would they contact AIDS Alabama?
So they would go to AIDSAlabamaSouth.org. All of our services are listed on our website, phone numbers for our clinic to access testing services. All the phone numbers go to our main desk and out to us. And you can also get in contact with any of our staff for outreach events. We love a party.
Right.
We 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 pull up to a party with a 40-foot RV with tests and urine cups. So,
Thank you. Well, I really appreciate you, one, for talking with me today and for just the great work that you do. And if you want to see more of the Prep Advocates Unleashed series, you can go to prepforall.org/prep saves and see more of the videos of amazing advocates and prep users from around the country doing amazing work. Thank you again today, Devin.
thank you, and thank you for your work.